you look a little beyond that and say, the woman is pregnant. Woman is pregnant. What next? First thing, I always tell my patient that it is a natural process. So whatever changes take place in your body take place naturally. You are not a queen because you've got pregnant. Don't consider yourself. You do your routine activities as you were doing them before, but you have to be a little cautious, that's all. Pamper yourself, yes, do pamper yourself, but not to the extent that you make yourself somebody very, very special, and because of which you start developing this psychological disturbances postpartum, which is a very big issue today. In the first trimester of pregnancy, in the first month, it is the embryo is just very soft and it is like a frothy material that is got together. There are no signs and symptoms that there's any activity that's happening over there. It's just development of cells that is taking place. But once you know you have missed a period, that is the signal for you to know that yes, you have conceived. And therein the changes are going to start taking place. What changes take place? First, your menstrual blood, the woman's menstruation stops, ceases. So the blood which is directed towards the uterus gets a redirected towards the development of the breast. And that is when the change takes place in the female body, wherein the breasts start engorging. Why will the breast be developed? Because the breast has to prepare itself for creating nutritive material for the newborn, because that's the only food. See how beautifully nature has done this. As soon as you are born, you already have material created for you to eat to sustain life till a certain age. Today, a lot of women are against this process of breastfeeding. They say they cannot tolerate it, but it is a natural process. If you do not do it, then you are setting in a precedence for your body to be subjected to cancer, which is a very high level today you see of breast cancer. One of the reasons of that is this. So once the blood which has gone towards the breast goes towards development of the breast, then it goes towards development of the other parts of the body, so that the body is prepared strong enough for the child to be living within that body for a period of 9 months and 9 days. In the first trimester, the immediate sign most of the women develop are nausea, vomiting, fatigue and tiredness, which is bound to happen because there are changes taking place in your body. So that is the time you rest for a little while. Do not indulge in all activities that you were doing in normally. Second activity that the body starts with is throwing out of materials which are not wanted by the body and the embryo inside. There might be a lot of material within the human body which the embryo will say it is not fit for me to be living in a condition like this. So best thing to do is the woman vomits it out. You may wonder, there are many a times I have seen cases wherein a mother has shown strong dislike towards a certain form of food, and the child born will also have similar dislikes or shown strong affinity towards certain kind of foods, and the child born will have the similar likings or affinities towards that kind of food. More often than ever, you suppress vomiting. As I said, vomiting occurs because these materials are not conducive for the child to grow, and the child which is inside is throwing them out naturally, saying that no. So if you suppress this, what you are doing is forcing your child in that womb to live along with the same material which are not conducive for that to grow. And then you talk about allergies that are being formed. Then you say, my child has got so many different allergies. My child is not healthy. The skin of my child is not good. Where is the beginning? The beginning is you have suppressed the vomiting, which you otherwise would have been a clean process. You would have naturally cleansed your body and your child's body as well. You suppress that, you start developing different forms of skin disorders postpartum. Many a times I have seen women who come with chloasma immediately after pregnancy, or the skin becomes black in color, and you ask and find out, had you taken these medications for stopping vomiting? Yes, they will say. Now, when is vomiting to be stopped? When it is out of control. When it is so terrible that your stimulation in the body or stomach becomes so much that you vomit about 20 times in a day, wherein the body cannot keep anything inside. Even this happens for a very, very short phase, maybe 5 or 6 days sometimes in the body when it is essential. But most often I haven't seen this going beyond throughout pregnancy. Yes, I have come across cases who vomit for the whole session of 9 months. This means that you have been indulging in food material which is not conducive for your child.